All right, welcome to everyone who's just joining us. That 30-second will be given. Was given so everybody can come and join us. Today is a late show. That's right, Kopi with Vans, and today we are going to talk about something with my guest speaker. Let's talk about changing our mentality from illness cure to wellness care. Of course, our regular guest speaker, Dr. Arvinder Singh HS, is going to join us shortly. Hello, Doctor.
Hi, good evening, bro. Good evening, everyone. How are you doing, Vince?
I am good, sir. How are you today?
I'm okay, sir.
Today we are doing the podcast, so a visual video will not be available, but of course it is going to Spotify as well, and
Right.
the same time it's going to Apple Podcasts and other social medias as well, which is LinkedIn, Facebook, and YouTube. Thank you, Doctor, for once again for joining us. Such a quite a is it a late or too early for you? What do you say?
It's still okay. It's still okay. I just finished work. So,
All right. Um, as usual, Doc. So we're going to jump in straight to the topic today. Before we even go in, Doc, why is it we call it mentally, from illness cure to wellness care?
right. So, let me just take a brief history through time. Lah. So, Vince, you will remember that when we were both very young, if you ask our grandparents where to go to hospital when they were not well, they will
Yeah,
refuse to go. Why?
right,
Because hospital was seen during their era as a place where people go and they were left to die. That
right.
was how a hospital was looked at. That is where the word hospital came about. There was some meaning to hospice, like today, where
Hmm.
you hear about hospice, which is end of life care or even giving palliative care to people, right?
Right.
So, of course, they are linked to cancer. Not necessarily people who are going to pass on, but
Yeah.
people who are also looking for support. Hospice is there to help them. But what I'm trying to say is, hospital was looked at very, very long time ago. I'm
Okay.
talking about maybe about 100 years ago, where it was looked at as a place where people will die.
Right.
But our generation, Vents, people look to the hospital as a place where they can go to get cured. So that was where the difference happened between us and our grandparents. Even our parents may have had a tough time telling our grandparents, look, you have to go to the hospital to get well. But our grandparents, their mentality was people go to the hospital to die. All right, because that was how it was those days, with diseases perhaps not very well known. People always felt that they only need to stay at home unless it is very severe. They go to the hospital and most of them end up dying. That was the thought of it then. So people actually thought that you go to the hospital to die, to for end of life care. But uh, our parents' generation and our generation, we know the hospital to be a place where we can seek help. You're unwell,
Right.
you feel you need medical support, you need tertiary care, or you need secondary care. You go to the hospital to get well. So
Mhm.
basically, there are two ways: either you go to a hospital to be admitted, or you go to the hospital to get outpatient care. But
Right.
generally speaking, we go to the hospital or even healthcare centers thinking that, I have a condition, I want to get better from this. All right, you have a cough, you go and you say, look, I have a cough, and you try to get treatment for your cough. You have a fever, you go to the place, to the hospital or to the clinic, and you say, look, I want to cure my fever, and that is what happens. Of course, the doctor will
Right.
have to conduct investigations and all that until they come to a diagnosis where they can give you the appropriate medication.
Right.
But we are going to face a problem because our kids and maybe our grandkids in future are going to
Mhm.
say, why are you going to the hospital or clinic or whatever only when you're sick? You should actually go and screen yourself even before you get sick. And
Okay.
that, I think, is the mentality change. Like how we never used to understand our grandparents not wanting to go to hospital to get care. It is going to be a time where our grandkids or even our kids will look to us and say, why aren't you going and getting yourself any help from these centers to prevent a disease from happening?
Okay.
So we have come from death to curative to preventive. So these
Right.
preventive centers, I know there are a couple in Singapore and also in Malaysia where they call themselves wellness centers. Now, this wellness
Right.
center, who are the people who go? It says they're wellness center. That means you're well, but you go there to get a screening done to make sure that you stay in that condition. So wellness is something which is a very new concept, which will allow people, healthy people, to make sure that they maintain that way. So if you go to a wellness center and you have some amount of condition which is about to skew off, let's say you're about to get hypertension, or you're about to get cholesterol problems, they can actually screen you and tell you, look, you're headed towards that part, let's bring you back towards that normal bit. And that is how it happens. So that is the new concept of curate. Instead of curative, we're talking about preventive, so you're actually talking about maintaining your wellness.
Right, Doc. So, to understand it much more clearer, right? So, what we are talking about is preventive, right? We know that the body is such an amazing machine or housing, that we live in. But like what you have said, preventive. So when we talk about preventive, nowadays is so sudden. We know that when we talk about myocardial infarction, heart attack, as known, it only happens 60 years, 60 and above, right? But nowadays, we look at it, the numbers has reduced, or rather, has come down. So as early as 30, we are hearing cases people having myocardial infarction, heart attacks, and so forth. So that's a little bit scary. So how can we talk about preventive in this kind of area? So does it mean that every year I got to go from head to toe screenings to check, like, because that comes under preventive care?
Yeah. So preventive care is not a really. I mean, it is what it is. It is preventive care, but I think maybe to the younger generation, it may not be a sexy term. So that is why they like to call it wellness. So that means there's a positivity to it. When you talk about preventive, you're talking about something negative from happening. So the element of negativity is there. So when we speak about wellness, wellness is positive. When you talk about someone who's well, it's positive. So people tend to move towards positive things. So coming back to your question, that whether we should get yearly checkup and all, it depends on when you go and get a screening done. I'm talking about you're talking about 30-year-olds. I'm seeing now 20-year-olds who I've seen before, who
Wow.
are actually very prone to heart attacks and even may have heart attacks also as well. And what we actually need to do is, these are the people who unfortunately have some underlying conditions where they may be having dyslipidemia, that means high cholesterol, or they may be having some amount of hypertension, or some family history to suggest that they may be getting heart attacks at a very early age. So all these type of things actually if you're going to go and experience a heart attack and then go to the hospital, then they have to get the full history down, and then only they come to diagnosis that, look, this person may actually be having a heart attack. It actually that it is a long process from there, in the sense that, to get to the diagnosis from the starting point. But if you're a person who actually goes and
Right.
indulges in wellness, that means I go and I seek a medical professional, and I tell the medical professional, look, I've just come to do a checkup, but actually my family has a history of diabetes, I have a history of hypertension, I have a history of high cholesterol, I have all different type of diseases. The doctor can actually look and narrow everything down and say, okay, you know what? For individuals like you, it is important that you come every 6 months or do your stress test, or even subject them if there are any ECG changes, or even any stress test changes, that maybe the person needs an angiogram, and
Right.
you may detect a block which has not caused a heart attack yet, but may eventually cause that in future. So when you actually detect it at that early stage, you have an intervention. Instead of treating the heart attack with long term, you actually prevent the heart attack from happening. So can you imagine, we have gone now from those days of saying prevent a heart attack, you prevent death from a heart attack, but now you're actually preventing a heart attack altogether. So it is actually, you're talking about maybe most probably less medications, shifting to a different healthier lifestyle, and all of this, which will actually assist with a better and healthier life, with a healthier life altogether. You look at it as
Right.
a way that you look at it as a way that why should I undergo through that trauma? My body has to undergo. They call it insult. That means even you have a heart attack, it's like a heart insult. All right, the heart is undergoing trauma. Why should I undergo that trauma when I can actually prevent that from happening? So as this idea catches on, you will find that people will be having the lifespan may not be longer. That means our lifespan in, let's say, Malaysia and Singapore is about 60 to 70, for example.
Okay.
People may still live up to 60 and 70, but their quality of years, because there are people who live up to 80, not all, but some people who live up to 80, but they are unfortunately bedbound because they have a stroke, or they have a heart attack where they cannot be mobile. But in this event, you actually get people who are actually 70 and 80, and what
Mm-hmm.
happens is they are still mobile and they have quality to life years. Now, that is what I highly think that is happening in Japan. Now, Japan, you always hear in the news, you always see people who are 100. It's a very common thing. It's a common phenomenon here. 100 means, it's a very rare thing, lah. But in Japan, it
It's a
is becoming
bonus.
more and more
Should
common.
we call
Sorry.
it as a bonus?
Yeah, it's a bonus. But why do they get as a bonus? Why do Japanese, are they actually very lucky to be living that long? I don't actually think so. I actually believe it is because the way they have channeled their people is actually to have health seeking behavior and to maintain being healthy, not curative. They don't encourage people to go for a problem, only when they have a problem to get medical treatment. One very interesting fact, we always hear about Japanese having stomach cancer, stomach cancer, stomach cancer, stomach cancer. Everybody talking about stomach cancer in Japan. But
Right.
actually, have you ever stopped to think, why are we actually detecting a lot of stomach cancers in Japan? The actual fact is because they look for stomach cancers. They actually do. Once the person is over a certain age, they make sure that the person undergoes a scope. They check for H pylori. They do all different type of tests to make sure that the stomach cancers, even if they are there, they are treated early. What we should be actually looking is at, how come the Japanese people, their survival rate from stomach cancers are so high? It's because they actually detect it early. So what I'm trying to say is, perhaps that if we move towards that direction, we are actually looking at preventing people from getting severe comorbids or even severe conditions in a very, very long space of time, okay, and which will affect their quality to life years. But now we are actually helping them to achieve better lifestyle, better quality of life in that same lifespan. And indirectly, that helps the health system in many, many different ways. Why? You don't become dependent. There's a lower chance of you becoming a person becoming dependent,
Okay.
lower chances of people who actually go and seek healthcare access for other different conditions. Like if a person has a stroke and they are bedbound, they tend to get bed sores. Now they have to go and see an orthopedic surgeon to get that sorted out. But if they are not bedbound, there's no bed sores to deal with. So
Right.
it makes resources put to better use, so to speak.
So, Doc, so let's get it. We dive in deeper, right? So we talk about screening to be done. I mean, these are all, I think. Uh, I think there is no certain age, but probably we will say, probably your expertise will say that above 35 and above, you should do all these regular checks. The most priceless that you can't buy is your health, right? You can be the multi-billionaire, but you can never buy health for certain, in fact, the whole area itself, you can buy certain things in life, but I think health is very important. But when we dive into wellness camp, so the wellness camp is also involved like taking care of yourself, make sure that you're mentally, you're stronger, fitter, physically as well. Be around with your loved ones. So could we add all that in the wellness care as well?
Of course. So we are talking about, some people consider 35 and above. Some places they consider 30 and above. Now, every time, when and I always see this, that when you diagnose a patient with hypertension or you diagnose a patient with cholesterol problems, which is quite advanced, the first thing they ask me is, doctor, if I don't take medicine, can I try doing exercises? But they have already sadly passed that stage. So if you come to the if you come to a place where they promote wellness within the well and healthy community, and they find, hey, look, your blood pressure is actually going towards the direction of having hypertension, you're not there yet, so I'm not going to give you medication. Why not you try doing exercise? Why not you try leading a healthier lifestyle? It may actually work that time. But if you're going to a place at a time where it is already beyond repair, it is beyond health, and you want to try with the lifestyle modification first, it may or may not work at that point of time. But if you look at it in the long run, if you're a type of person who say that, you know what, I prefer to do lifestyle modification, why not actually think about wellness, or maintaining your wellness? So you go to this place, you actually look at uh, all the different common comorbidities, like I was mentioning. You have to take a
Yep.
family history to find out what they have, and then they can check for that, and then say, okay, you know what, your cholesterol is slightly high. You don't need to start medication, but if you carry on or whatever you're doing now, you're going to reach there. Why not let's start proper lifestyle, healthy lifestyle conditions, do more exercise, maybe don't have a sedentary lifestyle, eat healthier. That is how you move to the path, and then you find people actually swaying off from getting comorbids to coming back to being healthy again. So that is the point where you find that all these type of things where you're telling people eat healthier, live healthier, exercise, it
Hmm.
plays a bigger role than doing it when I mean, don't get me wrong, even if a person is diseased and they start living a healthy lifestyle of exercising and all that, it's also good. But you need that medication component inside as well. Now this is what I'm saying, that if you're detected early, the medication component may or may not be there. You actually have something which can actually help you non-pharmacologically.
We doc, when we talk about exercise, that's expertise that I'm coming from. A person can be super fit, right, in terms of strength, stamina, endurance, but he doesn't smoke, he doesn't drink, but somehow or other, if you look at it, I mean, there's a few cases before that person actually had developed cancer. While the other end of the spectrum, a 90 years old smoking all his life, and he's still smoking away like a chimney, and he's living life without any issues. So how that explains, though?
So you must understand that genetic changes have happened over the period of time. Like those days, you hear people dying at the age of 80 and 90 to be very common. These days, is becoming less and less common. It's because of our food intake, a lot of other different things. So the only thing that person may have been exposed is maybe, like for example, cigarette smoke. But our generation, you may be exposed to pollution, you may be exposed to cigarette smoke, you may be exposed to asbestos in certain countries, you may be exposed to different carcinogens, or different form of material, or even chemicals that can actually cause cancer. All of this adds up. Of course, you put the smoking component, it becomes higher. But the other person who was smoking
Right.
did not have all the other components. So maybe that is why we are seeing a paradigm shift. But nevertheless, a person who has been smoking all his life may not develop cancer, but he may be having other or she may be having other comorbidities like coronary artery disease, hypertension, which will still
Right.
require medication. So if a person were to come who is a smoker, and you see that their blood pressure is not yet hypertensive but about to hit hypertension, they're having high cholesterol, um, these are the type of people who will have a high risk of actually developing a myocardial infarction. So what you
Right.
actually can tell them is, look, why not you stop smoking now? Let me help you to stop smoking. Let me help you to teach you what you should eat, what you shouldn't eat. Let me tell you how you can actually reduce your hypertension. By actually stopping smoking itself, you're already going to reduce your hypertension. By
Right.
already stopping smoking, you're actually going to reduce the coronary artery disease in that person. So these are all things which you do. You don't have to stop smoking only when a person gets a heart attack. You're telling the fella to stop smoking even before they get a heart attack, and you're preventing a heart attack. That itself is going to save. There was a research done that says that every cigarette consumed actually reduces a person's life by 5 minutes. So if a day
Right.
you smoke, a person smokes 20 cigarettes, it's already 1 hour, 1 hour and 40 minutes shorter a person's life.
Mhm.
So can
Right.
you imagine that the person is smoking 5 days a week? How many hours is that? You go back to a month, you're actually talking about a few days already, maybe a day and a half. So what we actually need to do is we need to stop them from actually causing damage to themselves. So it is not even once a person has a condition and then you stop all of this is damage control. Now you're actually preventing damage from happening. All right,
Right.
there's a fire that's about to happen. You don't wait for the fire to come on and then call the fire department to put it off. You're actually seeing, hey, there's a small flame there, this fella is going to build up and it can eventually bring down the building. I take a fire extinguisher and I put it off. Now even before the bomber or even the fireman can get involved, it's already done with. That is what we are planning to achieve. We don't wait for the fire to take up the a space where it cannot be managed, and then you find other people or other means to come and stop the fire where there will already be damage done. But now
Right.
that small fire is there, you just take a fire extinguisher, you extinguish. Yes, that floor or that place where that fire would have gone off would have been there, but that's about it. That's about them, and the damage is controllable.
Right. Doc, it's very interesting to understand. We didn't even talk about mental strength or mental resilience in the past decade. But if you notice, after COVID-19, the speech, or rather the attention, is now really focused a lot on mentality and even mental. They're talking about stress now. Coming up with different days, like you should work only 5 days a week, 4 days a week. All these sorts of things are coming in. Where we are heading to, I mean, in terms of mental strength or alertness, or even when we talk about resilience at this point in time.
So mental health is something which it is coming up because it is up. I won't say it's coming up, but it's getting more and more prominence in the field of medicine. Why? It's because during COVID-19 we found that a lot of people were quarantined, or people who were kept in their houses, and they actually started to feel the mental burden of it all, which in the past they may have just neglected because there were things to distract them, work, maybe outside world, and they come back and then they don't pay much attention to it. So but the good thing is, even mental health is mental health is also considered part of a person's well-being and wellness. WHO says that it is physical and mental health together. So if a person, I don't know whether I've asked you this before, Vance. Do you know what the psychiatrists are always worried of? The one mental health condition which psychiatrists are always worried of?
Let me see. Anxiety, anger.
No, no. The
Because if
the biggest
a patient sees a
the
psychiatrist in anger management, I think that's going to be an issue, right?
but you know what is the biggest worry that they have, not only for their patients but for themselves, is always burnout. Because it can
Burnout,
take,
right,
and
right.
yeah, some people take a week, some people take a month, there are some people who take years to come out from a burnout. So when this actually happens, they know. So a lot of psychiatrists, what they actually do is, when they think that they are already hitting the stage of burnout, or their patients are already hitting the stage of burnout, they immediately take a step back, because they know that if they hit burnout, it can be a few days, it can be a few weeks, it can be a few months, it can be a few years, until the person actually bounces back. So what we need to do is, you don't wait for the person to actually get a burnout, go and see a psychiatrist, and then the psychiatrist say, oh, I'm sorry, you have actually suffering from burnout. We have to take certain steps, we have to do certain cognitive therapies, we need to do certain therapies, or we need to give you certain medication so that it will help you. But again, the damage is already done. And what a lot of psychiatrists actually share with me is, when they know they're going to hit burnout, they stop. Now, that is what we're talking, because they are all well, they have no burnout, but they are heading towards burnout, they stop immediately. And just because that they stop immediately, some of them who have actually faced burnout in the past, who took a couple of months to recover, just actually needed a couple of days off, so that they can actually come back and bounce back, and they are back to normal.
Right,
So this is
right.
what I'm talking about. Just because of that, you imagine, I'm talking about the bigger picture here. I'm not saying that it is the other picture is not
Okay.
important, but think about it, that you have now a doctor or a nurse or a healthcare professional who is able to function at an optimum level for a better period of time. That's what I'm talking about, quality. Because if this person were to suffer from a burnout, I may be short of a doctor for the next 2, 3, 4 months, or 2, 3, 4 weeks, or
Hmm.
and that is going to affect my services, and that is going to affect other people. So can you imagine a worker who is working? Let's put a very simple example: a person who is working in a factory. Now, if this person is going to suffer from burnout, and you actually detect it early, and you tell the employer, look, this person needs a couple of days off, I think they're overworked, they're overstressed, give them a couple of days off and let's see them. And then that's what's happening in the UK, where
Hmm.
people are required to only work X amount of hours, and they can't work more than that because they find that people undergo burnout. Now,
Right.
when that happens, that fellow goes back, he has a proper rest, and he comes back. The productivity after he comes back is going to be maintained. So, if the company is actually very highly dependent on productivity of their staff, the staff is are going to work at optimal levels. But
Hmm.
can you imagine if they overwork that staff, and that staff now actually has to undergo treatment or even therapy for being overworked or overburdened or for burnout? The
Yep.
person may be away for a couple of months, and productivity is going to drop, especially if that person is the team leader, that person who is leading the line, that person is the most important person in that line. Productivity is going to be affected. So that is why I believe that big corporations, big corporate companies should, even though they offer people medical services, curative medical services for hypertension, for their
Hmm.
diabetes, and all that, I believe that they should also start looking into occupational health of maintaining wellness within. That means a person is well, they have not taken medical certificates or sick leave, but get them to actually do every 6 months or a year at least a mental health screening, a general health
Right.
screening, to actually detect. And there are a couple of companies here in Malaysia who actually engage, who want to do that. And you will be very surprised that you pick up so many people who have no conditions, they have nothing, but you find they are already prone to cholesterol disorders, or they are already
Right.
prone to nearly diabetes. Now, a lot of them, when you follow them up and you tell them, look, you're not there yet, but you have to change your lifestyle. You tell them, of course, you have to be very blunt with them and say, look, this is the best time to change, because if not, you're going to end up having diabetes. And a lot of them, a lot of their
Hmm.
family members have got diabetes. A lot of them they have seen, oh my god, the
Right.
fella has undergone dialysis, the person has undergone amputations, I don't want to reach there. And they change their lifestyle, and they come back within 3 and 6 months. And when they do another checkup, they say, hey, everything has gone back to normal. Can you imagine? You have saved that one particular person from going into a lifetime of problems. Of course,
Right.
the person has to
I
maintain.
know.
I'm talking, yeah,
Having mentioned that, right? I mean, some people are just too stubborn to listen to it. But I'm going to flash something here right now, about burnout. These are the few things that can show sign and symptom. But of course, there may be more. But reduced performance and productivity. That's what Dr. Arvinder has talked about in corporate companies, when the managers or even the bosses right now, it's not like, go and get for me more. You get them more, and then they want more. So eventually, the team is going to be fall into burnout. And right, that's one of the things that we talked about: anxiety, detachment, feeling listless, low mood, difficulty concentration, lack of creativity, and fatigue. But doc, in your expertise, is there could be more?
of course, definitely. Because one thing leads to another. Like, for example, if a person is burnt out, they may not be able to perform as optimally as what they normally could. Like, for example, a person can finish, let's say if a person is dealing with cases, they are able to finish 10 cases a day, for example. And then they finally find that they even get problem of finishing one case per day. Now, because of that, people may come and turn around and say, hey, you're not actually performing to your KPI. Your KPI
Right,
says
KPI.
10, and you are only doing one. We are falling behind. Now, that person has no stress, but undergoing all of this, the fella starts getting stressed. Because of the stress, the fella gets anxiety. And because the fella can't cope with his anxiety and stress, the fella gets depression. So you see, it's a whole
Right.
cascade cycle. It's a whole cascade cycle. It's a vicious cycle. But if a person can actually say that, oh, you know what, uh, okay, this person has some issues now. We are going to stop here before it becomes worse. Get
Right.
that person to a wellness center or treatment, and the person actually, oh, you know what, you're going to suffer from burnout, or you're not yet in burnout, but you're heading there. Give that person appropriate rest. The fella comes back within 1 week. He's able to catch up and maintain that KPI or whatever, which is actually very important, or any countables which are actually very relevant to the company. But if
Okay.
you keep pushing that fella, you are not going to get that.
But unfortunately, some companies are just like that, right? They just look at performance, KPI. Uh, but right now, I got to say that a lot of companies are, looking into different angles on benefits for their staff. But there are still some who just squeeze them until they just go haywire, right? I mean, something's going to happen in the next couple of weeks. I mean, we ever heard before, Doc. I think I remember clearly that you mentioned before, even in a particular country, a person was actually dead in the desk. No one has identified, right? We talked about that
Karoshi,
topic, right?
Japan. Yep.
There you go. So, I mean, the bosses want revenue. I mean, right? Staff also want to bring back what they deserve. So, where can they get a balance? If a staff find that this is not for me in this company, I need to leave, means he got to go. But some people are just, worried, right? I mean, they got to bring back the food. They got a family, so you know what? I'm just going to bite the bullet and press on.
Right.
But that's where the problem going to come in, right?
Right. So there are some countries like in the US, they have compulsory sabbaticals. They have compulsory sabbaticals where you accumulate your leave over X amount of time, but after that X amount of time, you have to take leave. You like it or not, there's something important or something urgent. There's something which is which the company depends on it. You have to take leave during that time. So the company has to adjust to your schedule to prepone or postpone as it goes to fit into your schedule. So that actually has some amount of belonging, and there is some gratitude for the staff as well. But at the same time, I think it also shares that the staff time is their staff time. That means if their own time is their own time. You find a lot of companies where staff accumulate so much of leave because they are so tied down to work. They can't take leave, they can't go here, they
Right.
can't go there, and their leave gets expired and it gets burnt and all that. So it actually causes more and more stress, and it actually reduces productivity. I think companies have to look at long-term goals instead of short-term goals. When you look at long-term goals, you're looking at, okay, you know what is my aim for the next 5 years? But if you go about and saying, okay, what is my company's next aim for the next 1 year? I want to increase productivity by 50%. It may not be realistic, because if you don't have enough HR, you don't have proper HR, you're going to be stressing those people whom are actually working for you. And you must remember that your company is not only considered to consist of people who are healthy. You have
Right.
people who are working, who are healthy, productive people who are even having some amount of conditions. And these people with conditions may end up in the hospital. Now, if you have 100 staff and 20 of your staff have a comorbidity and 80 of your staff are well. Now, the maximum amount of work is going to fall on the 80 staff, especially when these 20 staff, I'm not talking all at once, but some of them don't turn out work. People have to actually start accommodating them. Now,
Right.
you would like to keep that composition of 80-20. Why? Because you know that productivity can happen. Now, let's switch it the other way around. 80% of them have a medical condition, 20% of them are healthy. Now, if you keep
Okay.
that and these 80% of the staff continue working and they take a leave, or they take a medical sick leave because because of their condition, can you imagine what is going to happen to these 20 people? Now, these 20 people are going to end up with these 80 people because of their current condition. But if the office actually realizes that, look, these 20 people need to be maintained, their healthcare needs to be maintained, and they send them for every 6 monthly or yearly screening to make sure that they function optimally, you
Yeah.
can actually prevent these 20 people from going for the 80 people. But if you
Agree.
keep pushing them and keep telling that these 20 people to take over the workload of 80 people, maybe not at all at one go, but even at time, you will find that these people may actually deteriorate stress wise, anxiety wise, health wise. and they deteriorate and they join the 80 people. Then the following 2 3 years, you may find instead of 80/20, now you have 90/10. And who
And
is
then eventually you
ultimately
notice the staff may just resign, right? Or maybe he
exactly?
has
So
a medical condition like a blood pressure.
yeah, so you find that the staff resign and the new staff that comes in happens to be a person with a comorbid disease. So that is
Right.
also going to call you. So if people start thinking, a company starts thinking that I am producing people for the country, I'm not producing it for my company, I'm not producing it for the next company, I am producing someone who is going to work for the country. In that mentality, everybody will start looking after everyone, because it is not my company, your company, it is our country.
Our company.
When yeah, when
Right
they
now,
think that
just going to stop you for a while. I
sure.
flashed out something here, a link from www.psycom.net. It's a lot of quiz there. It's about almost about 10 quiz that you have to take to actually to identify or at least coming closer to know where you are right now for burnout. So very interesting questions, which I do myself time to time, and I think it's one of the best which I have used. So if viewers out there, um, if you think that you are feeling a little lethargic, tired, like what Dr. Arvinder said, sometimes if you this may not be the only one, the symptoms there can be more, but if you time to time, if you can just do these few quizzes to just to find yourself or take a certain holiday, right, a short holiday, or do something for yourself. I mean, burnout. So doc, the next question I'm going to ask you regarding about burnout, right? I mean, we just spoke about it. We take a lot of preventive care, all right, for ourselves to, I mean, before a fire starts, if you see a spark, we should extinguish it. But now the question is, if let's say if someone is in a burnout and he goes out, okay, I'm burnout, I'm going to do all the things for myself, I'm coming back after 1 week. Then he comes back to the same organization and within a couple of days he's burnt out again. So where shall we start from here again?
So that actually means that the person has not recovered from the burnout. That means that person has not fully
Right.
recovered, maybe partially recovered. So what that person actually needs to do is that person needs to identify what is a burnout for that person. Now, Vance, your burnout may be very different from mine. I may work maybe 50 hours and get burnout. You may work only 80 hours and then get burnout. So, but the thing is, once I reach 45, 46 hours, I must know, hey, look, 50 is coming and I really need to do something about it. You stop. And when you, as an 80%, you know that you're at 70, you say, okay, you know
Right.
what? There's another 10 is going to hit there. I'm going to stop now. But when you take that rest, you are actually coming back to normal. When you come back again, you are again ready, waiting to hit 80. Now, this person who has come back and may not have functioned optimally is because their target is 80. They were coming to you when they were 79 or 81. They've already hit that. Now, when they rest and they come back and then they go at it again, they are still hovering about maybe 76, 78. And after a few days, you find that they are already hitting the 80 again. So what they actually need to do is they actually need to know they need to know the warning signs, the indicators that they are already going to be burnt out, and then they need the break. But Vance, your break will be maybe a bit more longer than mine because your endurance is higher. So
Right.
that is why different people. That is why I said it is not a one system fit all or one method fit all. It requires care, it requires a detailed explanation, it requires proper clinical clocking before they can actually see signs and symptoms of recovery, and then they go ahead with it. So that is
Okay.
why,
So
yeah.
I gotta pause you here for a while because I think this is gonna be interesting because I just received a message. This particular person said, "Please do not mention my name." I'm reading it from my text. How about burnout from home from wife? So this seems to be quite hilarious. But so, Doc, you want to answer that?
We do get some people who say that they rather stay at work because they don't want to go home because they have spouse pressure. I won't say only the wife, even some ladies come and say that they need a holiday from their husband. Because of, I think it's because of expectations not being matched with what they perceive. So sometimes it is good to spend a couple of days or time apart. But again, I think it has to be reassessed to something which is long term, because a lot of people escape work to come home to get comfort. But if you're escaping home to go to work for comfort, there's something very wrong with the entire system. So I
Right.
think and these days they actually offer couple counseling. A lot of couple counseling. I don't think when I say couple, it's only linked to marriage or matrimony. Even some people, when they are like sports people, when they are a team player, let's say tennis doubles or badminton doubles, they need to understand each other. Sometimes they may be going through a rough patch, maybe outside the court they may be going through a rough patch, so they
Yep.
actually go for couple counseling to actually assist with issues that might happen, so that at the end of the day they can get through it. So what that person actually may be looking for is actually not burnout from a particular person, but where the expectations does not match. So they actually need to make a lot of lifestyle changes to one another, so that they can actually match proper. So
Right.
of course you can't be doing that in your workplace, where I mean, up to a certain point you can maybe don't, like I know of certain workplaces that lunchtime is lunchtime. You're not supposed to call that person, you're not supposed to do you're not supposed to disturb that person at that particular time. There are some places where a weekend is a weekend. There is no social media messages, no instant messaging, no calling, nothing. Even if you require something urgent and you actually send that person and that person does not do it, they are not obliged to do it, because it is their time off. So these are the type of things that can actually take place and work out. But of course, I think in an emotional sense of attachment or relationship, it may be slightly a bit different.
All right, Doc. I mean, we just got one more question regarding about the MNCs. All right, we're still in the burnout section. Toxic environment. All right, this could be the worst. We know the political games and certain environments. Somebody wants to get promoted, so they got to bring someone down, and someone want to get good names in the company. These are kind of sort of stuff that's going on, and some stuff can be very innocent. They just want to go in and get their job done, and get their pay and then move on. But some who's enduring it say that no, I can't leave because of environment or because of situation, because of economy, ever changing. So they tend to bite the bullet again and stay on and fight on. But that is the time that the person is pushing himself or her to the extreme part of burnout and eventually go into anxiety, because we have heard many cases where I'm not thinking on any particular organization. We're going to mention names here, but people tend to go on a certain leave, or they go on without pay, and some even resign, and they have been major cases as well. But how one can decide and say, you know what, this is toxic environment, I can't be here, I'm going to move. How will that be?
So I always believe that one man's apple or one man's food is another man's poison.
Right.
So it may be toxic for me, but it may not be toxic for you. So it depends on what our participation on different levels. So I think always engagement with stuff. I remember, like for example, I can share with you one particular company who this particular worker, uh, she was actually a general worker within that particular department. She was the best at her job. All right, she was really very good. She used to perform very well. Very little sick leave, very little medical leave, very little leave which she used to take, because she was really enjoying her job. She was really doing, and I think when they used to give her adequate time off and all that, so she was actually
Mhm.
very very happy at the place where she was working. Now, fast forward about I think 6 years down the line, because she was a general laborer, general worker, they decided to shift her to a different section of the company. Now, that section of the company had a different boss, they had a different manager, they had a different line of work. This lady had to relearn everything, and I think the processes which she had to undergo through, she's a laborer, right? So
Hmm.
the processes which she had to undergo through did not match her skills, which she's actually good at. All right. And that caused a lot of issues. She suddenly started coming with a lot of medical leave. She needed medical leave. And actually, after sitting and talking to her one day, she actually just burst out and told me, she said, the issue is I just cannot tolerate my workplace anymore because
Right.
I was so happy in Department X. Department X was treating me great. I was happy there. And now they have shifted me to Department Y. I don't know whether I can handle the job. That's number one. There's anxiety that's creeped in. My boss keeps coming and shouting at me and telling that I'm not functioning to my optimal, and he preferred the former staff which was there. So, which comes to the question of why was there a reshuffle in the first place? Now, the second question everybody would like to ask is not a problem with Department Y because there's some people from Department Y who have shifted to Department X and they find the same problem. That same place which this particular lady was actually having no issues at all. So it may not be the department as well. It may be because that person is not suited for that particular
Right.
job. So that person has to know for themselves that, look, I can tolerate this or I can't tolerate this. Like, for example, you can't get a fish to climb a tree and then scold the fish for not being able to climb the tree. Neither can you get a chimpanzee to
Right.
sing the person sing the chimpanzee underwater and say you swim and hold your breath when it's not built to do that. So
Right.
you and at the same time a chimpanzee or a monkey was actually meant to climb a tree and the fish was meant to swim in the ocean. So that is how we are each built. So whether we are actually finding that milieu or environment where we can actually go and say that I'm a fish and my environment is in the sea, and I'm a monkey and I'm a monkey and I'm supposed to be in the higher up trees, or I am just an insect which needs to go and look, which a bee which I need to look for flowers. I can't expect the bee to go to a river and pick up all the water and put it from one pond to another, because
Right.
even though the person has that capacity, but that is not what they were meant to do. So I think in finding that milieu, sometimes they have to undergo different processes. They have to undergo, unfortunately, some hurt, but until they find the proper milieu, then you will find that there is some work happiness and work satisfaction. So where you say that some people are toxic, it may be due to other things as well. They may not be in a job environment which they enjoy, because if they are in a job environment where they enjoy their work. I know a lot of people who actually come for therapy and saying, doc, I need you to tell me to learn how to rest. I was like, why? No, I work every day, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. I said, why don't you take some time off? Doc, I can't do it, I really enjoy my job. And I have people who come in for that. And you'll be very shocked to hear that there are people who are coming to get therapy and treatment for enjoying their job too much that they feel that they are neglecting other
Right.
parts of their life. So I think it's all about striking a balance.
Doc, I mean, that can be also be a OCD as well, obsessive chronic disease. When you focus so much into something and then if you don't do it for one day, it becomes like something like, not normal. But then
Right.
having said that, we are just going to bring the exercises part as well into for mental alertness, or even when you talk about mental resilience. And the body and the mind is always communicating. I've seen, there's no stats right at the moment, but out of 80%, I have observed those who are exercising regularly 2 to 3 times a week, not more than seven times a week, then you can easily go into burnout as well because of exhaustion on physical and muscular. But those who have been exercising, going through perspiration, going through the saunas, the lactic acid, the whole anatomy we can talk about, somehow or other they can able to control stress, able to stay away from all those stuff that we talked about. I mean, of course there is no guarantee that a person can still get a burnout, but exercises actually makes you stronger, sharper, give you all the tools mentally, physically, to stay away from all those stuff. We know that, right? But still there are a lot of people who are just not getting into the exercises regime because they find that I don't have time, or I'm already tired and exhaustion kind of stuff. So could be also a lifestyle changes that need to be done that can be added into the what we talked about earlier, which is the wellness care. So I think that will make great sense as well to to prevent somebody from going into all these aspects that we talked about.
Yeah. So, some people who exercise, you must understand that exercise is there to change our physiology. That means, if a person, okay, let's look at it this way: a person who is a laborer who works all day carrying heavy material, walking a lot, doing a lot of other things, that person's rest time may actually be physical rest, and they may need more mental exposure, mental health exposure. That means doing games, doing certain amount of mental work as well. Now, there are some people who have a sedentary lifestyle, who is all the while in front of the computer, 24/7 or around the clock, where they are actually working. And to break that monotonity, they actually need to do exercise. So it depends on each individual, but of course, whenever any, I always say that exercise is never bad. Every time you exercise, you're actually testing your physiology to make sure that your body works in optimal conditions. And of course, you must understand that the balance of physiology happens. One of the trademarks is actually because of exercise. So you're actually bringing your body to an optimal level to function at an optimal level.
Well said, Doc. I mean, that's. I think it's not a secret, but still, people, it's easier to give excuses rather than getting it done and getting executed it. Just to share a little, those times where the schedule can be really packed for most of us, right? We live in a world that we always have to run, but of course sometimes you need to just walk or even maybe sit, but just to get your walk done, for either a 1 hour walk or even 15 minutes, you got to do something. And even it's easier to give excuses, but you still have to go to do something in order to create a great habit. And anything more than 15 days or 20 days, it just becomes like a brushing teeth. None of us will forget to brush our teeth, right, Doc? Because I think it's
Yeah,
became a habit since young. But
right.
by exercising, there's so much we talked about: the physiological change, mental change, the emotional. Every hormones are getting adjusted. You feel good. You feel exhausted. But I think this has to be taken, into not only into consideration, but someone who wants to do it have to do it a baby step first, and then once you get it done, then I think you will thank yourself in the next 6 or 8 months time, right? You can see instant results.
Yeah.
We are already at
So
53 minutes. Is there any last tip of advice you want to give, Doc? Because we're trying to keep it here for 1 hour for today.
right. So I just wanted to.
Overall part where we want to talk about. Anything you want to say, Doc?
Yeah, so I just wanted to share that there are some companies that actually offer gym memberships or even sports memberships to their staff,
Yeah.
especially the executives, so that they actually do not neglect that physical activity which they so badly need. So there are some companies, that's why I said it depends on each company on how they do it. Some companies actually incentivize their staff for actually indulging in sports. Like for example, I know where there are certain companies, like for example banks or even certain companies, that they have sports teams, and they actually tell their staff, okay, we're giving you X amount of time off to actually
Right.
indulge in this sport because you're actually good in that sport. So it actually gives them an incentive to go and work out and all that. So that itself is a very good incentive. So I think we are talking about the art of creating different possibilities that works for each company. That means if I
Hmm.
have a company who is a labor company, I'm not going to tell them that, look, I'm going to give you a sports membership, because these people go back, they're already tired. But they may be given, let's say for example, access to online news portals, or access to online quizzes, or online portals where they can actually exercise their mental strength, and that will make a difference to them. So I think it is different needs for different people. And I think employers have to be really creative, and uh, get professional help to ensure that they move in the right direction.
Well said, Doc. It's always a pleasure of having you as a regular speaker at Kopi With Vans because we explore a lot of stuff. But of course, when we talked about the main topic is of course the wellness care, and of course we couldn't have enough much of a time to go into the illness care to wellness care. But of course, we will definitely will cover another topic on that. But Doc, it's in depth a lot of information that we talked about today, especially in burnout. I think all of us fall under burnout, right, Doc? I mean, including us. Do we fall into burnout as well?
Definitely, we are all prone to burnout, but whether we hit it or not is a different story, because maybe we know what our limits are, but sometimes we cannot be pushing our boundaries to see how far we go, because some people don't recover, completely recover from burnouts.
Right, doctor. So, having said that, thank you, doctor. Thank you so much. We will definitely come back again. This is our podcast. You can actually listen it to in Spotify and Apple Podcasts. And of course, today is not Wednesday. Today we are live as well on our podcast. It's going to happen every week or almost every week. So stay tuned till then. Thank you, Dr. Arvinder. Thank you so much, Doc.
Vance, can I just say something?
Please
One
go
of
ahead,
the
Doc.
part of one of the part of actually wellness is that you don't actually try, you prevent from actually getting, for example, COVID-19. So
Right.
instead of getting COVID-19 and then having the antibodies only for 3 months or so, why not you wear a mask? All right, practice physical distancing, hand washing, good air circulation, all of this which can actually prevent COVID-19 and long-term COVID effects. That is wellness compared to curative medicine of getting COVID and then taking medications. Of course, if you happen to contract COVID, there's no other choice. But if you prevent it in all those different ways, why not prevent it altogether? So that is the basic gist of curative and wellness. Thank you. Thank you, everyone.
Thank you, Doctor. You have a pleasant evening, and we will stay connected for our second part in Kopi with Vans.
Awesome, bro. Take care.
Take care, Doctor. Thank you so much. So that is Dr. Arvinder Singh HS, our regular speaker at Kopi Events, which I really enjoy our conversation backstage, on stage, on live, not on live. Great doctor, great friend who talks a lot of topics with us at Kopi Events. We're planning to do this on late nights as well, due to a lot of people have actually requested to have a late night show. But please do take note, it is on Spotify and Apple Podcasts. You can actually listen it. The topic will be, it's let's talk about changing our mentality from illness cure to wellness care. And this is your Vance at Kopi Events. I will be joining you soon next week, either Tuesday or Wednesday. We still haven't decided yet, but it seems like it's going to be a late night shows from now on, so that more people can be able to listen it live and ask questions as well. If you missed it, you can always join us in our Spotify and Apple Podcast. All you need to do is just type it out, Copy with Vance. Adios, amigo. This is Vance, and I will catch you all real soon.